Cpap and flail chest. Let's talk about that. So your patient experiences a significant mechanism of injury to the chest. They now have a flail chest and paradoxical wall motion. These patients can experience significant work of breathing. They either are inhibiting their work of breathing because of the pain, or they are working way too hard at breathing, but they can be headed towards respiratory failure. And in order to head that off, something like Cpap can be a very appropriate and helpful intervention. But with flail chest requiring such a significant mechanism of injury, wouldn't we have concerns for pneumothorax and thus have concerns with introducing positive pressure through Cpap, worsening that pneumothorax? The answer is that if you suspect pneumothorax, like not just because of the mechanism of injury, but they have signs and symptoms of a pneumothorax or a tension pneumothorax, then obviously Cpap is not going to be an appropriate intervention and you may want to decompress the chest. And another reminder that we don't generally decompress simple pneumothorax. We decompress tension pneumothorax. But if your patient doesn't have signs or symptoms of a pneumothorax, then Cpap is not only an appropriate intervention in this case, but a very beneficial intervention. And even if your patient has an undetected pneumothorax, the chances of that progressing to something clinically significant with the application of Cpap is incredibly low. And consider this, if you end up intubating that patient or ventilating them with a bag valve mask, the risk of worsening that undetected pneumothorax through positive pressure ventilation is pretty high. So Cpap is a very safe alternative to that. Cpap is not introducing tidal volume, and it can be very safe and effective for these flail chest patients with lower peeps between 5 and 10. Just remember not to set it and forget it. You need to be in constant reassessment mode with these patients, and if you have any concerns whatsoever for worsening pneumothorax or developing pneumothorax, then discontinue the Cpap. Follow your local protocols.